having one of these procedures done. So the first step would be you'd come see myself or come see Tracy or see Lisa and talk about, what's the next step. More often than not, I'm probably going to be referring you to Marie to get your hormones and all that kind of stuff figured out. You're going to have some blood draws done, and then you can have your treatment in the treatment place of your choice. So you can have your microneedling and the PRP done here, or if Modesto is better, you can have it done there. The treatment isn't going to take that long. So the microneedling, you come in, sign the consent, numb, treatment, half hour. Yeah. PRP a little bit longer because you're going to come in, I'm going to draw your blood, it has to spin down. Then we're going to go ahead and re-inject it. That's going to probably be an hour. And then hair transplant is going to be the longest because we have to gather the hair and then put it back in. So that's going to be, if I did just eyebrows, it's going to be about 4 hours. I'm going to do hair, it's going to be more in the 5 to 6 hours.
So
yeah.
For the eyebrows, you pull the hair from the back also? Mm-hmm. And so isn't it programmed to grow a certain length?
So it learns to be what it was transplanted into.
Okay.
Yeah, yeah. So you can train it. Initially, it'll be a little longer, and then it just, over the first 6 to 9 months, stops.
Calm down.
Yeah, it calms down and says, oh, I'm an eyebrow now. Yeah.
I feel like a little poke, but I don't feel pain like before.